My name is Robert Bache. I own Senior Healthcare Direct, MedicareBob's office. And in this video, I'm going to answer the question, is a Medicare Advantage plan cheaper than a Medicare Supplement plan? Thank you for joining me. It's Coffee with MedicareBob. I'm on our Facebook page right now, and I just got a question that I'm answering. And they asked me, is Medicare Advantage cheaper than a Medicare Supplement plan? And I think that's such an interesting question because the answer is yes and no. So for those of you that understand how Medicare works, there's two types of plans people can have, or two options for your coverage. There's Medicare Advantage or Medicare Supplement. Medicare Advantage is a private alternative to Medicare. So these are these plans that you see advertised as all-in-one, zero premium, Medicare Complete. You see Joe Namath on TV right now talking about how there's zero premium. And then you have a Medicare Supplement plan that you're going to pay an additional premium for, usually $80 to $120 per month. And in return, though, it actually pays the bills that Medicare doesn't pay. So it pays the hospital bills and the 20% that Medicare doesn't pay. So they're both good options. There's no wrong answer. Just a disclosure, if you start off with Advantage and you want to upgrade to a supplement plan later, you have to medically qualify to do that. So you have to be healthy enough to do that. If you start off with an Advantage plan and then later you want to go to supplement, if you've had any health issues, then you might get stuck in that Advantage and not be able to get a supplement. But in this video, I just want to answer this question, and I'm going to share this on my Facebook page as well because it was a good question on there. I'll probably put it on YouTube as well, and maybe Instagram. But I want to answer, is a Medicare Advantage cheaper than a supplement? It's a fair question. It's zero premium compared to maybe $100 per month. So if you look at the premium aspect, now with both options, you have to pay your Medicare Part B premium of the $145 a month. But as far as for the coverage, Medicare Advantage is often zero premium extra, so it's really the same price as Medicare. To where a supplement plan, you're definitely going to pay an additional premium, anywhere from $80 to $120 a month. So we'll say $100 for this scenario. So if you look at just the premium aspect, well, yeah, Medicare Advantage is cheaper, right? But let's really dig into this a little bit, okay? Let's look at if you actually go to use each type of coverage, each type of plans. Let's look at a knee replacement, for example. If you go get a knee replacement, let's just look at the cost aspect. Now, every Advantage plan is different based on the county you live in, but they all charge you something for a knee replacement. It's either going to be a copay, say $400 for an outpatient procedure, or it's going to be a co-insurance, meaning you're going to pay a percentage of 10, 20, or even 30% if it's a PPO plan on an Advantage for that procedure. Also with an Advantage, you're not going to get to choose your doctor. You're going to have a list of doctors that accept the plan that you'll get to choose from. So you have to go with one of those doctors that accept your plan. And on the cost aspect, you're going to pay for that knee replacement. On a supplement, you get to choose any doctor that does it, that accepts Medicare. So you can choose from nationwide, not just what plan, your limited area. But also, you're not going to have to pay the 20% because the supplement's going to pay 80% and the Medicare is going to pay 80% and your supplement pays the other 20%. So if you get a knee replacement, you won't have to pay anything for it, okay? So right there, just on the actual procedure, Advantage is going to charge you at least hundreds of dollars, if not more, if you have to pay percentage, to where a supplement plan is going to charge you $0 because Medicare is going to pay $80 and the supplement pays the 20%. Now, if you have a G or an N plan, you do have an annual deductible of $200 for the whole year. So if you haven't met that, you would pay that. But assuming you met that deductible by the time you get the knee replacement, you pay nothing for that procedure. So you get the knee replacement. Well, now, after that, you're going to have physical therapy, right, after your knee replacement. So how does that work? Well, with an Advantage plan, you're going to have to go to whatever facility is approved. So you might pass one or two facilities that you would like to go to that are closer to your home, but you might have to go downtown or towards the city to get your physical therapy. And on the cost aspect, you're going to have a copay for every trip. And normally it's going to be $25 to $55, depending on your plan, per visit. So I'll even use the low end of the spectrum, which is $25 per visit. Well, with a knee replacement, normally you get prescribed physical therapy 3 days a week for 6 weeks. So you go for a week, that's $75 a week in physical therapy. If you have a supplement, you pay $0 per visit, and you get to choose whichever place you want to go to. So flexibility-wise, you get to go where you want to go, and then on cost-wise, as long as you pay your premium, you're not going to have to pay for any co-pays for the knee replacement. So, Medicare Advantage is really only cheaper than a supplement if you're not really using the plan. A supplement plan, you're going to pay your premium, but then in return it actually pays your bills. So I don't necessarily agree that, I don't think an Advantage plan is cheaper than a supplement. Now, we could argue that if you look at a 10-year plan, if you're on a plan for 10 years and you're on an Advantage plan, let's say you have 3 bad years, you might meet that $6,000 or $7,000 max out of pocket. Or if you go 10 years, you pay the $120 a month of premium, plus you have some rate increases here and there. So which one will be less expensive in 10 years? There's really no way to know because your most unpredictable cost is your health care. So we don't know what's going to happen. You could be healthy for now, and then in a year from now, you could have 3 bad years, and so you just don't really know. But I can answer this question for sure. No, an Advantage plan is not cheaper than a supplement, and a supplement's not necessarily cheaper than Advantage. We don't know because we don't know how often you're going to have to use your coverage. If you have a crystal ball, and you're going to have some health issues coming up, then the supplement's definitely going to be cheaper than the Advantage, because if you have health issues, it's going to cost you more money than the supplement premium would have cost you. In that same crystal ball, if you know you're going to have a great couple of years health-wise, then yeah, the Advantage plan is probably cheaper than the supplement. So that's what makes Medicare choosing what type of coverage you want kind of challenging, because there's no bad answer. There's a purpose for Advantage, there's a purpose for supplement, and there's no bad choice. They're both good choices, which is what makes it more challenging in order to choose your coverage. If there was one that was awful and one was great, then it'd be easy. Now, I will, again, like I shared with you earlier, though, if you choose an Advantage plan now and you later want to upgrade, you'll have to go through medical underwriting. And when I help people with that, even though we offer both types of coverages, 85% of our clients do end up choosing a supplement because they truly understand the difference. And to them, they're looking at a supplement as they get older as a cost of living. I'm going to budget that $100 a month because I know it's not a matter of if, but a matter of when I'm going to want good coverage. I'm in the 4th quarter of my life. I want that quality of life to be great. I want to be able to go. If I need cataract surgery, I don't want to have to pay for it. I want to know where I'm going to go for it, get to choose where I want to go and not have to come up with any unexpected money. If I get a knee replacement, I don't want to have to come up with unexpected money. I want to go where I want to go. So that's a great question. But no, a Medicare Advantage plan, just because it's 0 premium, it's not necessarily cheaper than a supplement plan. I love answering your questions. I'm a firm believer that most people have the same questions, but a lot of people they don't know where to ask or too scared to ask. So please use me as a resource. I'm happy to answer all your questions. Drop it in the YouTube comment box. Drop it in our Facebook comment box. If you're not a part of our Connecting the Dots with MedicareBob Facebook group, I strongly encourage it. I do not do any selling or any value prop other than free education on that page, and it's just there as a community to answer questions for you. If you would like to work with a broker, Senior Healthcare Direct, MedicareBob's office, we don't cost you anything. There's no cost, no fee for our services. So if you'd like our help, I'll drop the phone number on the video, and I'll also put it in the comment box below as well. So thank you for watching Coffee with Medicare Bob.